So, just in short, what is all about? What Bowen comes to be all about? Is it just for physically healthy people who are under stress, or is it to help people who have certain traumas as well?
Both.
Both. Значи техника, която би трябвало да помогне и в двата случая.
I work primarily with people in chronic pain.
Предимно работя с хора, които страдат от хронична болка.
People coming out of surgery.
Хора, които са били оперирани.
People come to me, what I hear most of is, I've tried everything.
Предимно се срещам с хора, които идват при мен с изречението опитал съм всичко.
So these are often people that have had surgery, lots of physical therapy,
хора,
lots
които
of
са
training,
оперирани, които са имали твърде много физикална терапия, всякакви интервенции.
On high levels of medication as well.
Силни дози на медикаменти и въпреки всичко без ефект.
But I also see the guy that's hurt his back, so and he's just lifted something, he's hurt his back. So, but I see quite a lot of people in chronic pain, long-term chronic pain.
Основното, кои са пациенти, са тези с хронична болка. Can I ask you a question as well?
Yeah.
I'll just go in Bulgarian and asking the audience here, if they have a clue about this. Аз не знам колко от вас се сблъскали с тия диагнози фибромиалгия. Някой чул ли за фибромиалгия? Да. Енцефалопатична миалгия, чували сте за това?
It's my specialty.
All right.
ME and fibromyalgia.
The point is that in Bulgaria these are not recognized concepts, not recognized terms. People here, doctors in particular, they don't even have a clue what means fibromyalgia. Nobody talks about this.
You're going to see a lot more of it.
Surely. It is the Western type consequence of your health system. Sorry, personal opinion.
Absolutely, I agree. Yeah. I agree. Yeah. I agree. Yes, I'm going to come back to you. Can I just take this chapter's question? I had one thing to say. I spend a lot of time trying to make this man unemployed. People like him. So a lot of my people will be people that are going in for knee surgery that don't need knee surgery, knee replacements, because they have a back problem, you know, or they're going for surgery for their shoulder. There was a gentleman last week I saw who had major scarring through his throat and was about to have his muscles split surgically tomorrow, and because he can't swallow, he has to be fed through a peg. Can you translate this in a second? And he now, after one session, the surgery is cancelled.
Имам пациент, който беше планиран за операция на мускулите, тъй като не можеше да гълта мускулите около шията, но след само една сесия, една седмица с мене, той вече няма нужда от тази операция.
Because I'll put my hands on anybody, I'm cheap, easy. I'll give anything a go. And what have you got to lose?
Тъй като считам, че няма какво да се губи, ако помогнеш на някой. Ако не успееш, другия път винаги е възможно. What you've done for this patient? What particularly you had to do about this patient to help him?
Specifically, he'd had a large amount of removal through his various hives and various structures around his neck, so he had large scarring because of advanced stages of throat cancer.
Имаше твърде много съединителна тъкан и ръбцова съединителна тъкан заради рак.
So I took the principle of his head being in flexion.
Така че главата му беше в флексия.
Shortened through sternocleidomastoid fasciae.
С оплътнена стерноклейдомастоидна фасция.
And extended down into the top edge of the sternum.
Която стига до стернума.
So through working the sternum.
Така че работейки върху стернума.
Back edge of the galea aponeurotica and through sternocleidomastoid on its mastoid insertion, we were able to release it in 20 minutes. I mean, he's not having big chips or anything, but he's drinking water.
Поне може да пие вода и отпусна доста фасията за сметка на галеята.
And he hasn't swallowed in 2 years.
До момента не беше преглъщал 2 години.
Yes.
So it was the Bowen therapy who helped with this.
You know, it's a name. You know, whatever. If you recognize and identify where you can work.
Това е просто име. Ако осъзнаете принципа, по който
Bowen therapy is my therapy. I can show anybody how to work the way that they work. Just do less and go gently.
Бих казал, че това е въпрос на ус.
But yeah, I would claim that for Bowen. Yes, sir. Thank you for your question.
Благодаря.
Малко да продължа с въпроса за движението. Ако да накараш човека да се движи е това, което всъщност трябва да правим, т.е. да се движи за какво ни е въобще Bowen или която е друга терапия. Не е ли достатъчно да се движим правилно? Или проблемът е на какво точно помагаме с която и да е терапия? Помагаме на човека да се спомни как да се движи правилно?
Don't you think that just making somebody move is enough? That you don't need anything else, no form of therapy, no Bowen or whatever. If you just make him move, don't you think this should be enough?
No. Because sometimes it's already fuzzed, that collagen's already laid down. So we need to introduce movement to those tissues that are already stuck, that the impetus for movement from the individual isn't going to be... If I keep it moving, then fine. But once it's stuck, sometimes I need to go and change it.
Смисъл на Bowen е да внесем енергията, която ще накара замръзналия колаген да започне отново да се движи.
The other thing here is this, is that compensation causes conflict. If I stand and I put my weight onto this side, yeah, because this ankle has sprained, I now create pain in my knee. So unless I change my functional position to bring my pelvis back out of posterior tilt and even my pelvis out through this side, the pain in my knee isn't going to go. So unless I understand that, I can treat that knee for the next 2 years, or get him to move that knee for the next 2 years. Ain't going to make any difference.
Ако имаме завехнат глезен, ще натовариме коляното на здравия крак.
So it's not just enough to treat his pain. I have to look at him, I have to say, here is his position, how does he stand?
Тоест, за да се справим с резултата, трябва да разберем каква е причината. Едва ли ако лекувате само болката в коляното, ще помогнете на човека дори да продължите 2 години, ако не се сетите, че проблема е в другия глезен.
So the statement is compensation causes a conflict. So pain isn't a great signal. Thank you, I see you, I'm going to come back to you. Thank you for your question. Yes, Maria. Microphone, got the microphone? Just start, can you start your question again, sorry?
Okay, in Bulgarian.
Yes, please, in Bulgarian. I'd love to hear you speak Bulgarian. It's great. It's very sexy.
Мен ме интересува дали от позицията на Bowen терапия може да се лекува МС, multiple sclerosis.
Is it okay to think that Bowen can help for MS?
Okay, the first thing I want to say is the law of natural cure. We do not treat a specific condition. Somebody comes with cancer or MS or AIDS or whatever they've got
да
the
разберете, че Bowen не лекува конкретно заболяване.
I'm not interested in conditions. I'm not interested in diagnosing. I'm not interested.
Аз нямам интерес към заболяване, към диагнози, нито към лечение на конкретни заболявания.
But my patients who have MS, they've got MS. Does their MS go away? No. Does their function change?
С мултипла склероза се подобряват, независимо, че аз не мога да излекувам тяхната мултипла склероза.
They all feel better, they all move better.
Те всички се движат по-добре, чувстват се по-добре.
They all have a better quality of life.
И имат по-добро качество на живота.
It's like anything, it's like asthma or arthritis. Well, you have this condition, you have a condition, you have a condition. But the condition is personal to you, and it's you that I'm interested in. It's the person. Treat the person, not the condition.
Лекувайте човека, не заболяването.
Where was this young lady who had a... Where's she gone? Oh.
The question is, can you help people who are suffering deep emotional disturbance and people who have scoliosis, for example, cerebral palsy, for example? How much you can help such patients?
There's 3 questions. The question I would ask with cerebral palsy is, it's a question back. What's the problem? You know, just having cerebral palsy isn't the problem. But the problem comes because Janice with cerebral palsy has to overwork her shoulders in her wheelchair and she gets terribly stiff necks and pains.
Проблема е с пациентката Джанис, която ако има церебрална пареза и не може да движи инвалидната си ключка, е заради болката в раменете. И това е, което аз се опитвам да превъзмогна.
Emotional pain, I don't separate emotional pain from physical pain.
Аз не разграничавам емоционална болка от физическа болка.
If you imagine tonight that you go home and your beloved cat or dog or
Представете си, че прибирайки се до вечер
Granny
вкъщи, любимото ви
or
куче
mother has died,
или кот или близък просто го няма, починал.
or your boyfriend's run off with his lover,
Или приятел ви избягал
happens
с
to be
някой,
your brother,
който може пък да е ваш близък.
for example. Imagine the physical pain that we
Представете
experience
си
from that
физическата
emotion.
болка, която изпитвам от тази емоция.
How does a myofibroblast, we're getting into another subject, but a myofibroblast is looking to contract around pain and damage. My question would be, can a myofibroblast distinguish between the pain associated with spraining your ankle or getting kicked in the leg and your dog dying? And I think sometimes the line is very fine.
Мисля, че границата е много тънка между това как реагират миофибробластите, ако го разбирам правилно, на стимула, дали е болка от травма или емоционална такава.
But I don't believe that we have to have an emotional release in order to be able to heal. I think that can happen a lot of the time subconsciously and on a lower level.
Но смятам, че емоционалната болка може да бъде много често лекувана подсъзнателно.
Most of our emotions are subconscious. We wake up in the morning
Емоциите са подсъзнателни.
and we've gone from angry to happy to elated to killing somebody in half an hour. We haven't left the house.
За половин час може да сменим толкова емоции.
Who had the question? There was somebody there. Somebody moved. Was it you? Oh, sorry, yes.
Благодаря. Примерът, който даде той с човека с болката в глезена, но е много подходящ въпрос, защото в такъв случай имаме нарушение модел на движение. Тоест човека взема една позиция, която свиква да поддържа заради минала фактура, например. В такъв случай той не може да използва само Bowen терапия, това не е въпрос. Той трябва да даде някакво упражнение и се трябва. Това е въпрос.
So the question is if, like with your example with the guy who had the ankle sprain and then the knee pain subsequently, if you have somebody who has wrong posture, who has problems with the muscles because of a previous accident, trauma, fracture, whatever, would you only do Bowen or you would recommend some treatment, some physical therapy?
I think Bowen is a physical therapy.
Maybe it's my translation then. Some exercises.
Yes,
on the top of the Bowen.
Absolutely. I don't think listen, please don't get me wrong. I am not holding Bowen up as a shining beacon of a savior light.
Смятате, че съм дошъл за да кажа, че Bowen е върха на всичко и единствено решение.
You know what? It's a very, very good tool.
Това е много добър инструмент.
In 24 years, I haven't found anything that suits me personally better.
Аз лично за себе си за 24 години не намерих нищо, което повече да ме
But
удовлетворява.
mainly because I'm lazy and stupid.
Но това е защото съм мързелив и глупав.
Okay? Please understand that.
Разберете.
Okay? So from that perspective, I think that I can, if anybody's going to fix it with any kind of physical therapy, then I have a chance with Bowen.
Ако някой може да помогне с физикална терапия, със сигурност аз бих могъл
But
да
look,
помогна.
here's the thing. So many people will come to me and they say, oh, I have a headache.
Но ако при мен влезе някой с главоболие, например,
I don't understand why I have a headache.
разбирам, що ме боли главата.
You take them away from doing what they're doing and you fix them and they're fine. And they go, yeah, that's great, you know. And
Но
now they come
успеете
back.
да го накарате да се махне от ситуацията, която го кара да му...
3 weeks later, I have a headache again, the treatment didn't work.
Но ако дойде отново след 2 седмици главоболи, тогава...
You know, people are stupid. What can you say? If you keep doing what you've always done, you keep getting what you've always got. So we have to change it. We have to...
Тоест, ако един човек не прекъсва с едно и също оплакване, явно трябва да промени начина, по който му въздейства.
So yes, exercise, movement. Sometimes I would ask people to maybe do some breathing, maybe some meditation.
Да правят различни упражнения, дихателни го трябва.
Depends on the person.
Зависи от човека.
Should we take, yes, one more?
И другия ми въпрос, той каза, че все пак се подпомага раздвижването на колагена, но до каква степен, защото всички ни учат, че контрактури не се раздвижват.
To what extent you can modify the contracture of the collagen fibers, provided that most people know that contractures cannot be treated. You cannot overcome a contracture of a structure, joint or
Is that a question or a statement?
It's a question indeed.
I
To
don't...
what degree you can help with a contracture, maybe? Това ли е въпросът? До каква степен може да помогне с контрактура?
I think it's a very specific question, and I think a lot... The trouble is, I get a lot of people that will phone me or email me and ask me, I have a patient who has this and this and this, what should I do? And the answer is, I don't know, send them to me and I'll tell you. Because until I see you and I see what does your contraction